You come home after a long day, open the door, and you're greeted by something you definitely didn't want to see: another mess outside the litter box. You sigh, grab the cleaning supplies again, and wonder why your cat, who was always meticulous about using the box, has suddenly stopped doing so. Is this just a phase, or is there something more serious behind this frustrating change? Litter box problems are one of the most common reasons cats end up surrendered to shelters. But here's the reality check. When a cat suddenly avoids the litter box, it's usually not about behavior, it's often a sign of a deeper health issue. Cats rarely vocalize their discomfort clearly, but changes in their litter box habits are one of their primary ways of letting you know something's wrong. So how can you tell when your cat's litter box avoidance is medical rather than behavioral? And what exactly could be causing it? Let's start with the most critical sign that you should never ignore: straining in the litter box. If your cat is repeatedly visiting the box but producing little or nothing at all, this is an emergency, especially if your cat is male. Male cats can suffer from urinary blockages, which means crystals or inflammation are preventing urine from leaving their body. Without immediate veterinary attention, a urinary blockage can become life-threatening very quickly. This condition, called a urethral obstruction, usually shows up as frequent squatting without urine output, vocalizing in pain, or excessive grooming around the urinary area. Your cat may become restless or hide from you due to discomfort. Any combination of these signs is a red alert. Get your cat to the vet immediately. But not every medical issue presents itself so dramatically. Let's consider something less obvious but very common: urinary tract infections, UTIs, or bladder inflammation known as feline lower urinary tract disease, FLUT. Both conditions are uncomfortable and painful. Your cat associates this discomfort with the litter box and naturally seeks a place that doesn't trigger those painful memories, often soft surfaces like beds, carpets, or laundry piles. If you notice frequent small puddles or damp spots around the house, it's not just your cat being stubborn. Often, you'll see increased frequency, urgency, or blood-tinged urine. In female cats especially, UTIs can occur more often. The good news is, if caught early, these conditions are highly treatable. A simple urinalysis at the vet can quickly identify the problem, and treatment with antibiotics or dietary changes typically resolves the issue effectively. Next, let's talk about kidney disease, another major concern, particularly in senior cats. Chronic kidney disease develops slowly over time. One of the earliest indicators is an increase in thirst, followed by increased urination. Your cat's body is working harder to flush out toxins, so the litter box clumps might get significantly larger. The litter box fills faster, and sometimes the cat can't quite make it to the box on time. Owners often notice accidents near the litter box area or around the water bowl. You might also see weight loss, decreased appetite, or vomiting as the disease progresses. Regular veterinary checkups, especially as your cat gets older, can catch kidney disease early. If diagnosed promptly, you can manage it effectively through diet, hydration therapy, and medication, significantly extending your cat's quality and length of life. Now let's discuss another frequently overlooked reason your cat might be having trouble: arthritis. You might assume that arthritis affects only dogs or humans, but senior cats often struggle silently with this condition. Joint pain makes it difficult to climb into high-sided litter boxes or travel downstairs to reach the box location. A previously tidy cat may start having accidents simply because getting in and out of the box has become uncomfortable or even painful. Signs of arthritis can include hesitation or refusal to jump, changes in grooming habits, or stiffness when moving. The solution here is straightforward: offer low-sided or open litter boxes, place them in easy-to-reach locations, and consult your veterinarian about medications or supplements to help manage pain and inflammation. Another significant health issue is diabetes. Diabetes causes increased thirst and frequent urination, similar to kidney disease, and it can result in litter box overflow or accidents. If your cat suddenly has an enormous appetite yet is losing weight, along with increased water intake and urine output, diabetes could be the culprit. Early detection and management with insulin therapy and dietary adjustments can lead to excellent outcomes, returning litter box habits to normal. There's also hyperthyroidism, common in older cats, which increases metabolism, causing excessive thirst, hunger, and activity. This heightened state can lead to restlessness, increased urine production, and litter box accidents. Your cat might seem unusually hyper, meow more than usual, or display irritability. A quick blood test from your vet can confirm this condition. Medication, special diets, or radioactive iodine therapy effectively manage hypothyroidism, significantly improving your cat's quality of life. Don't forget about constipation or megacolon. These conditions can cause severe discomfort when defecating, making the litter box an unpleasant place. You might see your cat straining or find small, hard, dry feces outside the box. Early intervention, such as increasing fiber intake, hydration, and veterinary prescribed medications, can manage these issues successfully. Finally, older cats can experience something similar to dementia, called feline cognitive dysfunction. Cats with this condition might forget where their litter box is or become confused. They might start pacing, become vocal at night, or simply miss the box because of disorientation. While not curable, cognitive dysfunction can be managed through diet, supplements, and environmental adjustments, helping your cat remain comfortable and secure. So how can you tell whether your cat's litter box problems are medical or purely behavioral? Here's the general rule. Sudden changes in litter box habits usually indicate medical issues, especially if accompanied by other changes, like appetite, water intake, weight, or behavior. If your cat has always been consistent and suddenly isn't, the safest assumption is a medical cause. Start by scheduling a veterinary appointment. Don't wait and see. The sooner you investigate, the sooner you can identify and treat the underlying cause. At the vet's office, ask for a complete blood panel and urinalysis, as these tests often reveal hidden issues like kidney disease, diabetes, thyroid dysfunction, or infections. Be clear and specific about the changes you've observed. Mention how often accidents happen, where they occur, changes in appetite, behavior, or anything unusual. The more detailed your observations, the quicker your vet can reach an accurate diagnosis. In the meantime, take steps at home to reduce your cat's stress and discomfort. Keep litter boxes meticulously clean, provide multiple boxes if you have several cats, and place boxes in quiet, easily accessible areas. Consider softer litters if your cat has sensitive paws, and try low-sided boxes if mobility might be an issue. Most importantly, avoid punishment. Cats never respond positively to punishment, especially when they're already uncomfortable or in pain. Instead, reward your cat when they use the box correctly and maintain a calm, consistent environment that encourages positive litter box behavior. Remember, litter box issues aren't about inconvenience, they're about communication. Your cat can't verbally tell you when something hurts or feels wrong, so their litter box habits speak volumes. Early detection, compassionate care, and swift medical attention can dramatically improve your cat's life and your own peace of mind. If you found this information helpful, hit subscribe. Because when it comes to your cat's health, understanding their silent signals makes all the difference. Catching these problems early not only saves your carpet, it might just save your cat's life.